welcome to join us in this series of lecture of the cardiovascular disease for the medical student. The title of our lecture today is the hypertensive heart disease. Please pay attention. It's not a lecture for the systemic hypertension because this subject is scheduled in lecture of nephrology. But we will concentrate in the hypertensive cardiovascular disease and mainly hypertensive heart disease. Hypertension is the most common condition in primary care. Really, 1 in 3 patients have hypertension in adult population. And risk factor, it's a risk factor of the elevated chronic uncontrolled hypertension for myocardial infarction, heart failure, cerebrovascular accident, acute renal failure, even chronic renal failure, peripheral vascular disease, and even death. From epidemiological point of view, the prevalence is increasing, especially with age, and expected to be at the year 2025, about 30% of general population will have a hypertension. And its effort to effectively treat hypertension is not that strict, because about 81% of an case of hypertension, only 75 take treatment, and only about 50% they are properly controlled their hypertension to the goal of less than 140 systolic blood pressure and 90 diastolic blood pressure. So number of patients with hypertension in USA, suppose for example, is a 5 million. A number of patients with heart failure, 5 million. The percent of patients with heart failure to have a hypertension is about 75%. So this is a global epidemic, hypertension. In many countries, reach 50% of the population older than 60 years of old. In fact, this is too high, but overall approximately about 20% of the world adults are estimated to have hypertension. The prevalence dramatically increased in a patient older than 60 years old. Hypertension contributes to millions of deaths per year. Really, mortality of hypertension due to 50% of death from ischemic heart disease or heart failure, 33% from cerebrovascular accident, and 10 to 15% from the renal failure. And relative risk to have this below complication in a patient in uncontrolled hypertension compared with the same group that have an age group not a hypertensive. For relative risk, 2 to 4 increase to have a coronary heart disease, congestive heart failure, stroke, and peripheral artery disease, renal failure, arrhythmia like atrial fibrillation, even dementia, and mild cognitive impairment. Just a few points about classification. The Joint National Committee 7 for Detection, Diagnosis, and Management of Hypertension. This is a first number, I say systolic and diastolic. Categories: normal, pre-hypertension, stage 1, stage 2. Normal less than 120 and less than 80. Pre-hypertension 120, 130, 139, and the 80, 85. Hypertensive stage 1, is the, as we see, 142 than the 159, more than 160, and more than 190, and more than 100 in diastolic. Really, there is a new guideline to follow up, which is merged in the 2017 and 2018. This new guideline, normal, remain normal, new guideline, while pre-hypertension becomes stage 1. Stage 1 and stage 2 become stage 2 hypertension, while hypertensive crisis and both them become the same. To be more clear, look at this. So normal become normal the same, while pre-hypertension down to the stage 1, stage 2 becomes stage 2, while this elevated is not present in the previous classification. This is in a simple way. This is normal, in both category, JNC and the new guideline. Pre-hypertension becomes stage 1, and the pre-hypertension becomes stage 1, stage 2 and stage 1 becomes stage 2. That's enough, I think. So hypertension is defined as the presence of the blood pressure elevation to a level that places the patient at increased risk for the target organ damage or terminal organ damage in several of the vascular beds, including retina, brain, kidney, heart, and the large conduit arteries like aorta and its branches. While hypertensive heart disease, our main subject today, is a term applied generally to the heart disease such as LVH, left ventricular hypertrophy, coronary artery disease, cardiac arrhythmias, and congestive heart failure that caused by direct or indirect effect of prolonged elevation of blood pressure. So uncontrolled, please pay attention, uncontrolled and prolonged elevation of blood pressure can lead to a variety of change in the myocardial structure, coronary vasculature, and conduction system. These change in turn lead to the development of LVH, left ventricular hypertrophy, coronary artery disease, various conduction system disease, systolic and diastolic dysfunctions, and systolic diastolic heart failure, complications that manifest clinically as angina or myocardial infarction, cardiac arrhythmia, especially atrial fibrillation, and congestive heart failure. So hypertension is a disorder of intra-arterial pressure, such that the longer, the higher, the greater the damage. The longer the duration, the higher the blood pressure, the greater the damage to the target organ. This is left ventricular hypertrophy, concentric of left ventricle at the apical level, a gross sample, and it is quite different from the hypertrophic cardiomyopathy. If you remember, it's asymmetrical. This is asymmetric, concentric. So complication of hypertension, target organ in the heart, as we said, LVH, congestive heart failure, and the coronary artery disease. In the kidney is the renal failure, and peripheral vascular disease, and like ischemia in lower limbs, or the aortic disease, or the retinopathy, or hemorrhage and stroke in the brain. So the cause, what the cause of hypertensive heart disease is a chronically elevated blood pressure. The cause of elevated systemic blood pressure really divided into the essential or primary in 90% of cases, while 10% is secondary. There is a secondary cause. So hypertensive heart disease, please pay attention, coronary artery disease, heart failure, arrhythmias. And heart failure, diastolic impaired relaxation, left ventricular hypertrophy, and interstitial fibrosis, while systolic dysfunction, ischemic cardiomyopathy, and late consequence of the afterload increase. Arrhythmia, mostly atrial fibrillation due to the left atrial enlargement, ventricular arrhythmia also. Hypertension in general is a global problem. As we look to in 2000, about the 26% of population, adult more than 60, have hypertension. Expected in 2025 to be about 30% of general population will have hypertension. Few points about initial choice of treatment drugs, which is called add and only, and to start 20 drugs or 2 drugs or 1 drug to increase the dose and add the second. Previously, we used A, B, C, D. It means ARB or AC inhibitor, beta blocker, calcium channel blocker, diuretic. Nowadays, beta blocker is omitted from initial unless it is indicated, like ischemic heart disease. So AC inhibitor, beta blocker to start, or calcium channel blocker, or diuretics. The goal is to get blood pressure hypertension less than 140 and 90 millimeter of mercury, plus diabetic renal failure less than 130/80. This is compelling indication and obliged to this medication if the patient heart failure. So to start, thiazide, beta blocker, ACE inhibitor, IRB, aldosterone, as we discussed in heart failure. Post-AMI, beta blocker here to start, and that's a compelling indicator. ACE inhibitor, aldosterone, coronary artery disease, diabetes, renal disease to start ACE inhibitor, recurrent stroke, thiazide, ACE inhibitor in elderly, and so on. The best combination really we can use, this is the tick, while that the cross is not preferred, like calcium channel blocker, beta blocker. And that the ACE inhibitor, IRB, is not preferred to give, as a combination. In addition to the drugs management, you have to do a lifestyle modification like weight reduction, adopt a healthy diet plan, dietary sodium restriction, physical activity, and stop alcohol consumption. It is essential to treat patient. Yes, it is important to treat patient and well controlled because it reduces the risk of these complications, as we mentioned, even to decrease the progression. If anyone asks in which stage, it's pre-hypertension, why it called hypertension, elevated, stage 1, stage 2, will be discussed in detail in the lectures of hypertension. But in general, stroke, it will be reduced to 14%. Coronary heart disease to 9%, while all causes mortality about 7%, and only 5 millimeter reduction of the blood pressure, systolic blood pressure. But in general, overall stroke, coronary heart disease, all causes of cardiac mortality, it was reduced when controlled blood pressure. Thank you for joining us. See you soon.